Mr. Tan has just undergone treatment after a heart attack. And now he's wondering, can I do the same activities as before? Is there anything that I cannot do? How do I take better care of myself? According to Mr. Tan's physiotherapist, it is safe for him to gradually go back to his usual activities. He should first start with light activities and slowly increase the amount of work. This will allow his heart to recover without further injury. Mr. Tan will need to check with his doctor or physiotherapist if he wishes to start on a new activity. The extent and intensity of activities that Mr. Tan is able to do after a procedure or surgery will depend on Mr. Tan's age, the extent of injury to his heart, his previous activity level, and if he has had any previous injury to the heart. Mr. Tan will need to plan ahead for his day, as some tasks may increase the demand on his heart and cause him to develop symptoms. To plan his day, Mr. Tan should identify the easier activities, spread out his activities and alternate easy tasks with harder ones. Avoid rushing and take enough breaks in between activities. Avoid staying up late at night. There are some activities that will make his heart work harder and should therefore be avoided. They include moving his arms in a vigorous, repetitive manner, lifting heavy objects weighing more than 5 kilograms, working with his arms above shoulder level. In Mr. Tan's case, he is able to start on light household chores 1 to 2 weeks after his procedure. Light household chores will include using the washing machine to do his laundry, making the bed, ironing clothes, cooking, grocery shopping, washing dishes, sweeping and dusting. Heavy household chores will increase the demand on his heart and should be avoided for at least 2 to 4 weeks after the procedure. Strenuous activities will include washing the car, mopping the floor, carrying groceries, cleaning high and hard to reach places, washing the bathroom, hanging the laundry, gardening, and changing the ceiling lights. Now that you have seen what heart patients like Mr. Tan can and cannot do, let's move on to see how exercise can help you. Aside from taking medication and changing your diet, exercise is another important therapy that can help to improve your symptoms and prevent or slow down the progress of heart disease. A good exercise program can also prevent further injury to your heart. The benefits of exercise include improved stamina, reduced shortness of breath, reduced symptoms of fatigue, improved muscle tone and strength, improved balance and joint flexibility, lower blood pressure, loss of body fat and body weight. Every exercise session should include 3 phases, which are the warm-up, conditioning, and cool-down phases. The warm-up phase is the first phase of your exercise session, and it usually takes 5 to 10 minutes. Warming up prepares your body for exercise while reducing the risk of injury to your muscles and joints. The free hand exercises and stretches during a warm-up will gradually increase the workload on the heart and reduces the risk of developing chest pain and abnormal heart rhythm. The conditioning phase is where you perform the actual exercise, usually for 10 to 30 minutes. This includes aerobic exercises such as walking, cycling, swimming, or jogging. After your discharge from hospital, start off slowly and gradually increase your exercise time as you progress. Cooling down for 5 to 10 minutes allows your body to recover from the conditioning phase. This prevents blood from pooling in the legs as well as muscle soreness and tightness. Take a slow walk or do some stretching to return your heart rate and blood pressure to resting levels after the cool down. To get the best results from your exercise, remember to stay FITT, which stands for frequency, intensity, type, and time of your exercises. It is ideal to exercise about 1 hour per day on most days of the week. There are 4 ways to gauge the intensity of your exercise, and you can do this by monitoring your symptoms, breathing, pulse rate, and using the rate of perceived exertion scale. You should feel comfortable while exercising, and there should not be any pain or discomfort. Stop all exercise if you experience any symptoms such as chest pain, giddiness, difficulty in breathing, and excessive cold sweat. It is normal to breathe faster and harder during exercise, but your breathing will become increasingly difficult when you exercise too hard. You are exercising at the correct intensity if you are able to slowly count from 1 to 15 without stopping more than 2 times to catch your breath. The resting pulse rate, or RPR, is the rate at which your heart beats while you are resting. To measure your RPR, place 2 fingers on your pulse near your wrist and count the number of beats within 10 seconds. Multiply this number by 6 to get your RPR. When exercising, your pulse rate should only exceed your RPR by a maximum of 20 beats. For example, if your RPR is 80 beats per minute, your safe exercise pulse rate should be less than 100 beats per minute. You are advised to take your pulse before your warm-up, at regular intervals during your walk, and 5 minutes after cooling down. The rate of perceived exertion scale is used to gauge if you are exercising at the right intensity. The desired range during exercise is between 11 and 13 on the scale, and you should feel that you are exerting yourself fairly lightly or somewhat hard. Aerobic exercises such as walking, cycling, swimming, and jogging are recommended as they help to improve the stamina of your heart and muscles. Walking is the easiest exercise for you at this point in time, and you should consult your doctor before you start on any form of strenuous exercise. Time refers to the duration of your conditioning phase. You may gradually increase your exercise duration from 20 minutes to 60 minutes as advised by your doctor and physiotherapist. Here are some pointers on exercising for diabetic patients. As your body burns more sugar to give you energy during exercise, the combined effects of physical exertion and diabetic medication may lower your blood sugar level during and after exercise. If your blood sugar level is lower than the recommended range, eat a piece of fruit before you exercise. Do not exercise if your level is above the recommended range. Diabetic patients must stop exercising if they experience any symptoms related to low blood sugar. As low blood sugar levels may occur at any time during exercise, it is good practice for diabetic patients to always carry a carbohydrate snack with them, such as a piece of fruit. Those who do not have a glucometer to check their blood sugar level may exercise 2 hours after a meal to be safe. Diabetic patients may also consume a meal rich in carbohydrates after their exercise to replenish their blood sugar level. Now, let's get started on the exercises. You can perform these exercises at home based on the advice from your physiotherapist or doctor. Remember to take your resting pulse rate before and after you exercise. Remember to check your blood sugar level before and after you exercise if you are diabetic. Shoulder shrugs. Move your shoulders up and down 5 to 10 times. Shoulder rotation. With hands on your shoulders, draw big circles with your elbows 5 to 10 times. Shoulder flexion. Raise your right hand and put it down 5 to 10 times. Repeat with your left hand. Elbow flexion. Bend and straighten your arms 5 to 10 times. Trunk rotation. With feet apart, turn your trunk to reach across your body for both sides 5 to 10 times. Trunk side flexion. With feet apart, bend your trunk to the left, then right, and repeat 5 to 10 times. Calf stretch. Put your right foot forward, bend your right knee, keeping your left knee straight, and hold for 5 seconds. Do not put one foot directly in front of the other. Repeat for the other side. Inner thigh stretch. Stand with your feet apart and bend your right knee. Keep your left knee straight. Do not turn your body and hold for 5 seconds. Repeat for the other side. Front thigh stretch. Hold your right ankle and hold for 5 seconds. Ensure that your knees are pointing to the ground. You may hold on to a stable surface for support. Release and repeat for the left side. Marching on the spot. Support yourself with one hand on a sturdy structure to your side. March on the spot for 5 to 10 seconds. Sit to stand exercise. Place your palms on your knees and gently push yourself into a standing position. Sit back down and repeat 5 times. Knee extension. Straighten and bend your right leg and then your left. Repeat 5 times. Heel raises. Hold on to a sturdy structure for support. Tiptoe and lower your heels to the ground. Repeat 5 times. Hip abduction exercise. Support yourself with one hand on a sturdy structure to your side. Raise your right leg to the side, lower it back down and repeat 5 times. Turn around and do the same for the left leg. Please approach your physiotherapist or doctor if you have any questions.